The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I have with me a first-time guest. So excited. This is going to be a unique show. Going to be an awesome topic about marketing your practice and standing out. Without further ado, Dr. Dannica Brennan, say hello.
Hi, everybody. Thanks for having me on the show.
Hey, so excited to have you here. Let me kind of explain how we came to invite you on the show. So I actually saw a post on Dental Nachos that you made where you were showing some artwork that was in your practice that creates a lot of conversation and buzz amongst your patients, team. So that's how you're here, and we'll get into that a little deeper. But first, what I want to do is ask, or secondly, what I want to do is ask Dr. Brennan, how did you become a dentist? What made you get involved in dentistry?
Honestly and truly, my mom was a big factor in that. I was all really, really good at like sciences and stuff. And my mom kind of pushed me into the medical field and was like, hey, either become a doctor or marry one. And so when I got into college, I had a lot of friends on my swim team who were actually going the dental route and kind of intrigued me because it's better than being like a glorified script writer. So I actually got to, we get to do stuff with our hands and stuff. And so I started shadowing and just sort of fell in love with it.
Yeah. How long have you been practicing for?
So I graduated in 2018. I did an AGD with the Air Force for a year right after that, and I've been practicing.
Yeah. So you now you currently own a practice, correct? Just to make that clear.
I built my office. Yep.
You scratch startup. What made you decide to do a scratch startup instead of buying out a practice or joining a practice as an associate?
So like I said, I went from dental school right into a military residency, right into practicing with the military. And in 2020, like during COVID, I decided I wanted to get out of the military. And I actually started listening to this other podcast called Shared Practices, which was pretty cool. And it like really, the first season was like all about like whether you should be a practice owner or not. And I thought about just buying a practice because I never thought I could build one. And I'm very type A. So I'm very like, I like things, if you saw my post, I like things a certain way. And the military just wasn't, as much as I love my patients, I didn't really love being in the military per se. And so I decided ownership was definitely the route to go, and looked into buying offices around here, and nothing just fit my vision. And so I had a lot of friends that ended up building their own offices. And I was like, if people like who I went to school with can do it, so can I.
Yeah. So you're in Tampa, the Tampa area, correct? Which town are you in?
I live in Tampa, but my office is in West Chase. It's
okay.
20 minutes from Tampa. Yeah.
What made you choose West Chase to do a startup?
I did a demographic study through Dentographics, I think is who I went with. And they gave you like this really cool map with all the hotspots, and you get a pick. And honestly, like a lot of it was, I just drove around and looked in the kind of those hotspot areas. And I had like my two main ideal patients. Like I know a lot of people have one, I have two main ideal patients, and I like built up a story for each one. And I decided like which area would bring in both of those patients. And so that's how, and I just kind of drove around and around and around for months and months until I finally found something. I actually had found another spot, but it didn't work out due to leasing issues, and then ended up finding this one, which was even more perfect.
So tell me, how did you come up with the name of your practice? You have a slightly different name than most. How did you come up with it?
I wanted to have something that was a bit more fun and not just like, Dannica Brennan, DMD, or West Chase Dental. Like I don't know, I hated that. And so I played around with a lot of I worked with a marketing company who also kind of like gave us some ideas. And, I always like to do that stupid dance, the floss. You know what I'm talking about?
Sure.
Like,
yep.
yeah. And especially here in Tampa, there's a lot of like ology, yogurtology, and things like that. And it was my mom. I think my mom or my husband who was like, what Flossologie. And so it's something that in my mind was like, somebody might see that and want to click on it. Like they type in dentist near me and I pop up and they're like, oh, that's different. Like, let me click on it. And then I have this beautiful website that also is not very your norm dental website as well. So that was kind of the goal, was to stand out like from the beginning online too.
Yeah, and I'm gonna a couple of times during the program ask our audience, check out the website. It's flossologie.com. Certainly check it out. Let's talk about the artwork. That's how I came to know who you are. Talk about the artwork that you have in your practice, and where did you get it from? What is it? Tell me about it.
So hang on one second here. Lumba, come on, get in here. So here in Tampa, especially like St. Pete, the street art is huge. It's everywhere, and I've always been like really obsessed with it. So like the sides of buildings, everything like that. And there's websites you can go to. People just go and find these places to post about. Tampa is also very big for like influencers. So a lot of like really famous TikTok, Instagram, people like that. And so my mom was my interior designer for the office. She designed the whole place. And we were trying to like think of like something cool to put on the walls. And I was like, how cool would it be if we like did some street art? And it ended up just like developing into this whole deal. I have a couple of my favorite artists. And so I reached out to a couple of them, and one reached back out and was like, I'd love to do it. So I basically commissioned them. I told them what I wanted in each room. So we have 5 main pieces and five huge walls. And we spent probably 3 months going back and forth deciding on how to do it. And then during construction towards the end, they came in for 3 weeks and painted and spray painted everything. So it was all done by hand. It was like the coolest thing I've ever seen, but it was all just, it makes me happy going in and like seeing, I guess the goal of my office was to not feel, look, or smell like a dental office. So that was more of the look to it. And not only that, but like my main hygiene room, the one where patients first come in and see, is just tagged. Like there's just tags everywhere. And I find a different word hidden in there every day. And so it's cool because patients can sit there and just watch and look at the wall and like be kind of mesmerized. And we also specialize with patients with anxiety. So this helps like kind of keep them calm. It doesn't have that normal dental vibe to it. So there's a lot of reasons why I liked it. I think my, other than like patient centric one, was it just really makes me happy. Like no matter how crappy of a day I'm having, I can look at my artwork and just, I love going to my office kind of thing.
Yeah, it certainly stands out. And I'll say right now that your office isn't for everyone, right? It's not for every patient. It's certainly not for every dentist. Would you agree with that?
Yes. Although I will say, you would be surprised. So I don't enjoy doing like dentures, and I do very high quality. I practice biomimetic dentistry. So it's very, very high quality. Everything is under rubber dam. I have a CEREC. I do everything same day. But so I don't really enjoy like the dentures, removable stuff. But I have had a few like more older patients come in and they love the artwork. I was really surprised. Like they actually really like it. But no, it's definitely not for everybody.
Yeah, I think when you advertise to everyone, by the way, and you create messaging for everyone, you're literally creating messaging and advertising to no one, right? So I think you've done an amazing job of that. I think carving out a niche is always a good thing. If more people like it than you think are going to like it, that's even better, right? That's certainly a win-win. So one of the things that you have going on your website, we'll share photos and maybe even some video on YouTube and on our site. Tell me about the dogs. I see dogs everywhere. Tell me about that.
So my husband and I have 2 of our own and then 3 cats. And we just adopted out our last foster. So we usually have fosters in and out. We're really big animal people. And I kind of wanted to honestly and truly, one of the main goals of getting out of the military and owning my own office was so one day we could have enough money to like have our own little suite where we can adopt and foster, I guess, hospice, like the older senior dogs and stuff. That's like one of our main goals in life. So we work with a lot of local animal rescues here, just through fostering, volunteering, donating. And so one of our like different things is we actually do a discount at our office for anybody who's actively fostering animals. So it's something different, and like I like that. I mean, I could have gone the military route. I was military. I probably should have, but I also like I'm not in network with any insurances, so it's hard to like military people tend to be very insurance driven a lot of the time,
Sure.
but I wanted to give back to something that meant to me. And so I do a 20% discount in my office for anybody doing that. So that's where a lot of the dogs and stuff come from. And I think it's cute on the website too. It's inviting and shows I'm real and, invites people to see into my life as well. And I wanted to show that on my website.
Do you advertise that outside of your website?
The fostering discount?
Yeah.
Yes, we do.
Where do you advertise?
All the rescues advertise it. I do.
For you?
I do a lot of social media. That's where the majority of my patients come from. So I do post about that. Instagram's big on it. I go to a lot of events to volunteer, and so I hand out cards and mention it. A lot of ground marketing is really good for me too.
Yeah. What percentage of new patients do you think find you specifically just because they go, hey, I see that you do this for fostering, and maybe they don't foster themselves, right? But they appreciate the fact that you do, right? Or they support the charities that are fostering. What percentage of patients are coming to you for that?
I'm probably maybe 20 or 30%, like a decent amount. And we had the news, like ABC Action News, reach out and do a segment, and they did a story on us, and it ran for like a week, and we got a ton of new patients from that. Because they talked a lot about the fostering stuff too. So
yeah, animal people are crazy, right?
Yeah.
Right? And I mean that in a good way. And, I think a lot of people that are not animal people totally agree with that statement, and people that are agree with that statement. I know my wife has fostered many, many dogs and supports a lot of rescue type charities. Should be all over it. Right. And I know a lot of people, you can actually, and this is where you can take, when you've got something so unique, you can do direct mail. I don't know if you know this, you probably do. There's actually, you can buy lists of people who have donated specifically to animal related charities within your area in the last year, right? So that these people, not only do they really like it, they're willing to write a check and spend money on these types of things. So amazing job there. And it's a win-win for you, right? I mean, you're supporting something you love and they're supporting you doing it. How can you go wrong with something like that?
Not only that, but I would rather have patients in my chair getting discounts of patients who I enjoy and I can relate to, and who enjoy, we have similar interests and likes, versus somebody there paying full price who maybe isn't as relatable, and so I just tend to find I enjoy our conversations more with the patients who have that kind of, who I can just relate to more. So I also really like that too.
Trust level is higher, right? Yeah. Patients are going to trust you right off the bat, or more likely to trust you. It's easier to build rapport. It's easier to build trust. Right. And you just enjoy being at your job more, don't you?
Yes, very much so.
Yeah. I remember one time, it's a little off subject, but I have a client who's an Air Force dentist, right, in private practice now. And I asked him, is it harder? And he's like, well, kind of, because patients literally couldn't refuse treatment when I was in the Air Force. He's like, they couldn't ship off if they didn't, do certain levels of care. And I thought, well, that's fascinating. So what's next for you, Dr. Brennan? What do you got on your radar? What are you going to do next?
In terms of marketing or
just anything. I got a feeling you're not done. I got a feeling you haven't reached your end game yet. So what do you have on the horizon for you and your practice?
No, actually, I think I have. I'm so particular. My husband and I are trying to start a family, and I want to have just an office that I love going to and can actually practice. I mean, I want to build the office more. I don't want to own multiple practices. I want it to be a very small, very boutique-y office. It's 4 ops total, so 2 hygiene, 2 regular. So for me, I don't plan on hiring an associate anytime soon. I just want to grow the office so my schedule gets busy. I mean, we've only been open 3 months, so I'm still growing in that aspect. But I want to add in some more fun toys and technology and all that good stuff. But I don't really have any plans for huge growth, as in multiple offices, multiple docs, things like that. This is more so for me and to be able to sustain something and practice long term that I'm just going to really enjoy.
Yeah, that's awesome. One more time, the website, flossologie.com. Check it out. Check her out on social media. How do we find you on social media, Dr. Brennan?
So I have 2 Instagram handles. One's just Dr. Dannica. That's my personal one. And then the fun one is just Flossologie, and it's with an IE. So we do a lot of fun stuff on Instagram as well.
Awesome. Thank you so much for being here. We appreciate you.
Yeah, of course. No problem. Talk to you guys later.